So today I'm here. It's not that I'm here to actually share with all of you on how to prevent, because I actually believe prevention is always better than cure. Okay, so allow me a little bit of time to introduce myself. I'm actually a professional pharmacist, and I'm involved in wound care for the past 3 years. And now I'm actually a certified wound care pharmacist, and I work as a community pharmacist. So I actually get to know from Greg. We have actually a lot of diabetes questions throughout the 2 days, and I will actually share with you guys on the diabetic foot ulcer and how to prevent it. And as you guys know, diabetes will actually bring some complication towards like stroke, and yet it will actually lead to the bed-ridden in the end. So at this point of time, so how to prevent pressure ulcer? Okay, let's go through my slide. Okay, first, what is diabetic foot ulcer? Diabetic foot ulcer, normally the patient will actually notice there is actually a wound started to form at the plantar sole of the foot. So normally, we actually common site is actually plantar sole or the toes. So it's actually a wound that is actually can't heal or poorly heal, and you can see it's already started to go through the dermis of the skin. And it's actually, how is it formed? So normally it's actually formed through the repetitive injury when you walk, when you stand on the floor, okay? So these are the things that will actually cause repetitive injury to the side of the foot. So this one actually sometimes the patient is actually having lack of sensation, poor blood supply. So these are the patients are more prone to the diabetic foot ulcer. So as you can see from the slide, there is actually a picture show where is the common sites of the diabetic foot ulcer. So these are the 4 spots that normally a diabetic foot ulcer, a diabetes will actually have. These are the 4 spots. And as you can see in the slide as well, there are 4 stages that normally a professional will categorize it. We actually range from stage 1 until stage 4. So at the stage 1, it's already set an alarm for the diabetes patient. Hello, you need to notify me. You have to notice me. I'm here already. Please take good care of me. You have to get a good shoes to actually offload the part that actually the diabetes patient, when they actually already have the first sign in the stage 1. If not, it will actually start to proceed to the stage 2, and then stage 3, and then stage 4, and you can see there's actually big ulceration at the stage 4 already. At this stage, the patient might actually go through a series of the wound dressing, and the cost is actually not cheap as well when you want to handle this kind of wound. So please, when you notice if let's say any patient in your house is actually having diabetes, they have to have the check on the leg every day. So to prevent this from happen, what should we do? What can we do? Okay, I categorize the 10 do's to actually help to prevent the diabetic foot ulcer. So may I know any diabetes patient over here? Maybe you can raise a bit of hands. Any diabetic, or your house having any diabetic patient? 1. So maybe you want to have a chat. Okay, so the 10 do's, the first one is inspect your feet every day. Okay, how you need to inspect? Just get a mirror and put actually below your foot, and then you check. Okay, so you have to check it for any cuts, any blisters, or even any redness. When you actually when you're actually sitting, when you remove the pressure from the feet, there is actually redness that cannot disappear. So these are the points that you have to actually see and view. So if let's say there is anything is actually mentioned in the list here, so you have to notify your doctor straight away. Next, diabetes patients actually have the problem of dry skin. Okay, and even ourselves having dry skin as well. But for diabetic patients, their skin is, they are more prone to the more drier skin, and the dry skin will lead to skin breakage. The skin breakage will actually increase the risk of fungus infection, bacterial infection. So this infection will actually cause the wound, fasten the worsening progression. So we actually, the wound will actually faster to progress to the stage 4 in the end. So choose a good moisturizer and moisturize it every day. But bear in mind, there's one part of the foot that you should not apply the moisturizer, which is in between the toes. Okay? So because in between the toes, when you apply the moisturizer, it might actually increase the risk of fungus infection because the fungus love to actually stay in between the toes because the humidity is higher. Oops. What is happening? So next, we actually, okay. Okay, next is actually the toenails. Okay, the toenails cannot cut until too short because when you actually cut until too short, it will actually lead to ingrown nails. So please, when the diabetic patient will cut your own toenails, just do not cut until too short. There is actually a risk of having corns or calluses. The corns is actually the hardening skin on the plantar foot or in between the toes. So when the diabetic patient is having this, do not treat yourself. Do not go to the store to buy, or pharmacy store. But then when you go to pharmacy store, please consult the pharmacist as well how to use the acid treatment for the corns. Because if let's say you just simply put, it might actually lead to another complication as well. Next is make sure you wear dry and clean socks and change it every day because the used socks might actually cause the fungus infection growth as well. Next, a diabetic patient, we actually advise them to actually always wear closed shoes. But when you actually wear the closed shoes, please make sure before the patient wear the closed shoes, check inside first, okay? Because the inside may actually have some objects or the small little stones is inside. So just shake it and then check and see whether anything's come out or not. Then you only wear inside. Next one is you might consider to apply the antiperspirant to actually reduce the risk of fungus growth and also bacterial growth. Next is actually remember never walk barefoot even you are at home. Even though at home you can choose to wear slippers instead of closed shoes. So this actually can prevent you step on something without you know that you step on something as well. The last 2 points is very important. Even though when you have the wounds already, a controlled diabetes level is super important for you to actually have the wound healing faster. So please take good care of the diabetes level. Last but not least, this is not a common practice in Malaysia, but it's actually very common in overseas, which is get your foot checked every year, at least every year. When you go to the doctors to have the foot check, the doctor won't just tell you, auntie, your leg is okay lah, everything nice, okay, you go home. Then you think, oh, I spent money already, then how come nothing? Okay, but the doctor will actually check, how is the blood flow towards the foot? Okay, whether you have the good blood supply or not. Next, they will actually check whether or not the diabetic patient have a good sensation. Because sometimes we actually, the patient will lack of sensation, the nerve system already damaged at the foot area. So even though they step on something, they can't feel. So periodic check on the sensation is very important. So these are the things that the doctor will help you to check. And then also, how is the skin condition? Are you applying the lotion or not? So these are the things that they will check as well. So please go to have a GP to do the foot check. Those are the sharing on the diabetic foot ulcer. So how you should actually prevent it by actually doing the 10 do's. In case there is anyone that actually you are having any bed-ridden patient at home that you need to take care of, okay? So I would like to share something about pressure ulcer, which is actually currently a lot of of cases that come into my pharmacy recently. Okay, they will keep asking me, Stacy, how should I take care of my mother? She's a bedridden patient and she can't move anymore. But then we scared that she was having the bed sore. Because when you're having the bed sore, it's actually a very, very terrible cases already. You have to change, you have to do the wound dressing. So these are the things that normally I will share with all of them. Okay. Pressure ulcer is actually known as more layman is actually bed sore. Okay, you can they actually happen at the back. Okay, and the wound is getting larger and larger. And it's a kind of injury under the skin as well, resulting from the prolonged pressure and the friction. Because the patient will actually lie down on the same position every day. If let's say the caregiver never go and turn the patient, the prolonged pressure and the friction, the improper movement will cause the pressure ulcer. Okay, why it actually will happen? You can see if let's say the prolonged pressure is against the skin, right? It will actually stop the blood, it will actually impede the blood flow, and hence it will actually stop the flow of the oxygen towards the area. Same thing from the diabetic foot ulcer, we categorize it into 4 stages, from the stage 1 until stage 4. These photos might not be able to show clearly. Okay, you can see from here, this is stage 1. You can see the buttocks start to be reddish. Okay, so same as DFU just now, it set an alarm for the caregiver already. This, already having the stage 1 pressure ulcer, please do something for me. Okay, so from here, so you need to go for a doctor to have the check or have to get something to actually apply on it to actually prevent it actually worsening. Normally at this stage, we actually advise the caregiver, make sure turn the patient. I will share with you guys how to manage in the later while. This is stage 2. Okay, when you can see, it's actually the second affected until the second layer of the skin. So it's actually appear reddish. And this is a good wound bed, which is actually a good condition. So when you actually handle it properly, it will heal very fast. Stage 3 already. As you can see, you see some yellowish inside. So this one is actually the fatty layer. Okay, so it's actually affect until inside already. Last. It's currently, I see it maybe I have colleagues to send me photos as well in asking me how to manage this kind of wound. This kind of wound, like from stage 1 until stage 4, it can just happen within 3 weeks. If let's say didn't handle it properly. So please handle properly. So you can, this one, sometimes you can see the tendon, you can see the bone, you can see the muscle already. So it's very terrible. Okay, so into this kind of stage, we have to do the prevention. Okay, so as you can see in this slide, okay, normally if a bedridden patient, okay, we will actually on the hospital bed, on the bed, we will lie the patient down flat. Okay, but actually we need to turn the patient one off. Okay, so we actually categorize into 3 types of position. One is actually the supine position, which is lie on the back. Okay, flat. Second type is actually on the side, laterally. Okay, towards the left or towards the right. Okay, last but not least, the patients you can still move the patient down. You can sit on the wheelchair. Different side, the common pressure points is different. As you can see at the line on the back, we always have to check the heel, the tailbone, the elbow, the shoulder, the back of the head. These are the common pressure point. Okay? So, how should we prevent the sores? Repositioning or turning the patient every 2 hourly is the main key. Okay? I know it's very difficult to take care of a patient, but turning a patient is the key to prevent the sores. I have a videos here to show to you guys what is the correct method to turn the patient. For the caregivers as well, because the caregiver don't get hurt when you actually move the patient. You have to juggle yourself as well. Okay? And next is like how to turn the patient correctly. Can I have the video to play?
To reposition a person on his side, that is into the lateral position, begin as usual by gathering your supplies, which in this case are 3 additional pillows. Position the bed at a comfortable working height to protect your back. Then make sure the wheels are locked for safety.
Go ahead, take your pillow.
Remove the person's pillow, placing it at the head of the bed on its edge against the headboard. Then, lower the head of the bed so that it is as flat as the person can tolerate. Lower the side rail on the side you will be working from, but leave the opposite rail up. Fan fold the top linens to the foot of the bed. Stand at the bedside with your feet about 12 inches apart and your knees slightly bent to protect your back. Move the person to the side of the bed nearest you by first gently sliding your hands under the person's head and shoulders, then moving the person's upper body toward you. Gently slide your hands under the person's torso and move the person's torso toward you. Gently slide your hands under the person's hips and legs and move the person's lower body toward you. Now you are ready to turn the person onto the side. Grasp the person's arm nearest you and cross it over the chest. Grasp the leg nearest you and cross it over the other leg. Then place one of your hands on the person's shoulder that is nearest you, and place the other one on the person's hip that is nearest you. Gently roll the person away from you. Place pillows under the person's head and neck, lengthwise between the person's knees and legs, under the person's upper arm, and behind the person's back.
Comfortable?
Make sure that the clothing and bed linens underneath the person are smooth with no wrinkles. Then, draw the top linens over the person.
Yep, thank you. Okay, so this is the video to show to you guys how to take care and how to turn the patient. So we are actually advised like normally, okay, so first 2 hours, we just let the patient lie down flat. After 2 hours, we turn to the right. After 2 hours, we'll turn to the flat again. Then after that, to the left. Okay, so you might want to ask me, so how about during the night time? I want to sleep also ma. Takkan I no need to sleep every 2 hours. I need to wake up and go and turn. Okay, so there's one way. Okay, I'm for sure. Okay, if let's say you're having a bed-ridden patient at home, you actually know about Ripper mattress. Okay, you can see there is actually a bubble. There are actually 2 types of Ripper mattress in the market. Okay, one is called the bubble mattress, which you can see in the picture. Another type is actually called the tubular mattress. Okay, so for bubble, how you want to choose the correct one? For the bubble mattress is only for those who want to prevent the pressure ulcer to happen. When actually for the prevention and for the treatment wise, you have to go for the tubular type. Okay, don't go for the bubble type. So if let's say there is a bed-ridden patient at home, just grab a bubble mattress for the prevention will do. So this one will actually evenly distribute the pressure. But during the daytime, please turn the patient as well, even though you have the Ripper mattress. Cannot fully rely on the Ripper mattress. Okay? So next tips, okay, is actually same as DFU. The skin have to be moisturized. Okay, dry skin will cause the skin breakage I shared with you guys just now. Okay, so moisturizing the skin, okay, and also, moisturize the skin with a good moisturizer to actually help in. Sorry. Okay, this is the correct slide. Okay, moisturize the skin with a good moisturizer will prevent the skin breakdown, and then it will actually help to prevent the pressure ulcer. It's actually reduce the friction, okay, and also to prevent the easy skin breakage during the turning part. Next is actually same thing, inspection is very important, okay? So when we actually inspect the skin every day, we can notice it at the early stage. Then we can treat it as soon as possible. Last but not least is just now Dr. Warren share with us how to manage the incontinence. We have just now the physiotherapy share with us the Kegel exercise, but those are actually for those that is not a bedridden. So how about already bedridden? Okay, so normally we will wear the diapers. Okay, so when the patient is wearing the diapers, every 2 hours please check whether the pampers is wet already or not, or soiled. Okay, so in that case, please change the pampers. Okay, and remember never double the diapers. Okay, so for me, okay, so currently I actually involved in the certain home care services as well. I work together with doctors and nurses and physiotherapists, and we actually provide the care at home for my patient. I love to actually help these kind of people in how to manage the patient at home. One thing is de-stress the caregiver, because caregiver is very stressed one. We're actually handling a patient like a bed-ridden patient at home. Okay, so for me, prevention and early detection with proper treatment do save the lives and prevent the worsened condition. With that, I end my slides. So if let's say in the future you have any question, you can drop me an email, okay, at stacyto@alpropharmacy.com, or you can actually contact me through this number. Okay. So yes, right, I'm done. Thank you so much.
For Stacy. Hello. Okay, Stacy. Now, do we have any questions for Stacy? Okay.
I would like to ask, just now you said apply a good moisturizer. What do you mean by a good moisturizer?
Okay, a very good question. Okay, a good moisturizer, it means that because when we actually, the diabetic patient or bed-ridden patient, they will actually have more sensitive skin. So the lotion, you don't simply buy those, it's actually having the fragrance, okay, and the moisturizing property is very low, which is actually very watery. Okay, so you have to go for those that actually have a good water retention, a good humectant, which is actually having what we call is actually oil and water balancing. So when actually the portion of the oil is better inside the moisturizer, it actually protects long-lasting moisturizing. Okay, and then it actually reduces the need of applying more time. Okay.
Okay, oh, madam, I'm going to come over.
You want the brand name?
Hold on.
Now, if we were to buy a moisturizer, we normally read the label.
Yep.
What do we look out for at the label for a good moisturizer? What kind of ingredients or any tips?
Okay, normally we actually look for that is actually having the glycerin. Okay, and there's actually a lot of moisturizer in the market, but you have to actually go inside the pharmacy. Okay, the pharmacy will let you know, okay, which one actually having a better humectant level. Because humectant, the ingredient name is actually changed according to the brand name, according to the brand. So if let's say you want to ask me which is actually a better brand, you can actually come to me later on, and I can share with you few examples that actually having a good moisturizing property. Okay.
Big round of applause for Stacy, please.
Thank you.